We are live.
Good evening, everyone. Welcome to this insightful session on common pitfalls in manuscript submission and how to avoid them. We have a great faculty today, Professor Dr. Vanati. Uh, Going through the manuscript submission, it is a crucial step in sharing our research and knowledge with the world. However, the path to successful publication can be challenging, often fraught with common errors and oversights. These pitfalls not only delay the process of publication, but may also diminish the impact of well-conducted research. This webinar aims to shed light on these common challenges and provide practical strategies to everyone, ensuring smoother submissions and enhancing the likelihood of acceptance. Together, let us refine our approach to manuscript submission and elevate the quality of our articles. I welcome chief guest of today's proceedings, Dr. Padma Shri, Professor Lahani sir. Chairpersons, Dr. Apurva Aichit, we are consultant at Joshi Institute, Hubli. Professor Dr. Purvi Bhagat, who is heading the glaucoma clinic at MNJ Regional Institute of Ophthalmology, Ahmedabad, and editor of Global Journal of Cataract Surgery. Discussants for the today's session, we have various faculties from medical colleges across Maharashtra. Professor Dr. Rekha Khandelwal, who is at NKP Salvi Institute of Medical Sciences, Nagpur. Dr. Naina Poddar, Professor at TNMC and Nair Hospital, Mumbai. Dr. Aditya Kelkar, we are consultant at NIO Pune and a prolific researcher. Professor Dr. Ajit Joshi, who is heading the department at Bharati Vidyapit Medical College and Hospital, Sangli. Professor Dr. Archana Vare and Professor Dr. Vaishali Une at Government Medical College, Aurangabad. Dr. Sahil Agrawal, Assistant Professor at RP Center, New Delhi, and Assistant Editor of IGO. Dr. Surbhi Agrawal, Consultant VR Surgeon and Cataract Surgeon at Netradama Super Speciality Hospital, Bangalore, and Assistant Editor of IGO. Professor Dr. Charuta Manke, HSBT Medical College, and Dr. Aryan Cooper Hospital, Mumbai. Dr. Sachin Agrawal, Associate Professor at IGM Nagpur, and my co-moderator, Dr. Sabyasachi Sengupta, who is a veterinary surgeon practicing at Future Vision Eye Care in Mumbai and founder of Sengupta Research Academy and ex-associate editor of IGO. Now I call upon Professor Lahani sir for his word of wisdom and inauguration of this webinar. Thank you, sir.
Thank you, Rajesh. I think I must appreciate this is a very good and useful webinar. And Rajesh and all the cancer series, all the MOS office bearers and who are can say the today who are going to guide us, and Vanati madam who has really I think I must welcome her for this. I think the co-editor for there about the more than 10 years in the IGO. What I have seen is very small mistakes they make. And I think Vanati will definitely tell them that when they send the manuscript, then they what are the our guidelines? They never follow the guidelines of the you can say journal, whatever the guidelines we give. Secondly, when they write, the language is so poor that we don't understand what they are writing in that. So they never correct their language. That is always a problem when we say that. The abstract what I saw that time is very weak and titles. I think they never go with the abstracts and like that, and they directly submit that. Another thing is the originality of the work. See, whenever you are submitting, you must see the originality of the work, but they never see that, and that can be seen the originality of the work. And sometimes what I have seen, the data is completely incomplete. It means not complete only, and that data is submitted. Simple thing they can change the this one the ethical issues. So we can say always the plagiarism is there. Now there is a software we can see are you repeating the same or not. Software is there. We can just see we are doing it like that. And whenever we are sending, what happens? The we are sending it to the peer review. So we must take opinion from the people, you can say the positive criticism, so that we can submit it properly, and that will help us. Another thing is, even what I see is when they write the letter to the editor, in that nothing is written, just submitting this one. But why you are submitting? What is there? What you want to highlight? So that letter should be properly, and a complete letter should be there, but doesn't happen. Sometimes they can say, reviewers, they say ki this is lacking in that. We never think of that. And what I have seen sometimes, the medicines people submitting their abstract to the ophthalmology, it means definitely some another journal. So there are so many problems, and simple problems are there when they are submitting. And I think the Vanati will guide, so that whenever you are submitting your research, that will be accepted in the journal, and that research will help us for the, can say, the as a researcher, and also the something to guide others. So I think I welcome Vanati, and she will, I think, highlight all these problems. And thank you very much.
Thank you, sir, for those word of wisdom. Now I call upon MOS President Dr. Shirish Thorat for his opening remarks.
Thank you, Professor Dr. Rajesh Doshi, sir. On behalf of MOS, I welcome you all for this much needed and very important webinar. As Dr. Rajesh said, publishing our research is very important for advancement of our knowledge, which influences our clinical practices also. However, the journey of research to the submission and publications sometimes become a daunting task. A well-crafted manuscript can be rejected due to common avoidable errors and missteps in the submission process. Thus, knowing common pitfalls and how to avoid them is of utmost importance for our success. Friends, to guide us on this issue, we have a galaxy of surgeons and teachers. I really thank you, our wonderful experts and panelists, for being here today. Their wealth of knowledge definitely help us understand publishing and submission process better. I'm sure this is going to be a much fruitful webinar and academic feast for every one of us. My special thank to all chairperson, moderators, and discussants. Special thank to speaker of today's webinar, Professor Vanati Madam, who is editor of IGO. My heartfelt gratitude and thanks to Dr. Padma Shri Dr. T.P. Lahane sir, who is the chief guest of today's webinar. And most importantly, he is, contesting for election of vice president of AIOS. Well, are with you, sir? Thank you. Back to Dr. Rajesh.
Thank you, Dr. Shirish. Now I call upon Dr. Sabyasachi Sengupta for the introduction of our esteemed speaker, Dr. Vanati.
Thank you, Dr. Rajesh, and very good evening, everyone. And I'm so excited that Dr. Vanati has found time from a very busy schedule, as a clinician and as a researcher, and now as an editor, to share her pearls with us. So I have known Professor Vanati for now more than 10 years, and and I know how tough the job at IGO is. And she's been doing a splendid job since she's taken over. So quickly introducing her, she's a professor of ophthalmology at the RP Center, AIMS, New Delhi, for the past 18 plus years. She has more than 50 international indexed publications to her credit, and more than another 150 in international and national non-indexed journals. She has authored more than 50 chapters in national and international books. She has been a reviewer for several indexed international journals, and now she is the editor of IGO. So she has worn all the caps that are possible, from being an author to a reviewer and now to an editor. And she has also mentored more than 50 MD, PG thesis, as well as mentored PhD students. She's been the chief author in some of the most landmark review articles published in survey ophthalmology, especially on keratoplasty, and I think all of us must find time to read some of her papers. She has been presenting instruction courses and free papers and videos in several international and always major presence at the AIOS. She's received several awards, important ones being the gold medal from the IRSI in 2013. And undergraduate, she has been, sorry about that. So She has also written 2 popular textbooks in ophthalmology for postgraduates as well as undergraduates. And she has been awarded the best paper of IGO in 2021 and IGO Silver Awards 2022 as well. And she's also got the Ames Research Excellence Award 2019, which is really competitive and not easy to get at all. So I welcome Professor Vanati to our podium and hope to have a great learning experience with her. Thank you so much. Ma'am, over to you.
Thank you. Yeah.
We will start.
Yeah. Thank you so much for your kind words, Dr. Sabyasachi, and thank you to Mos. Thank you, Dr. Rajesh, for the invitation to be part of this nice learning webinar here. So I think we'll directly delve on the next 15 minutes to look at what would be the common mistakes when one is submitting your manuscript here. So I think this is not an exhaustive list here, but this probably at least sort of aims to orient you to the common errors which happen when one is submitting to a journal here. And please do bear with me if I do sound critical at times here, but this is only for your own, for the benefit of all the young minds here who are, aiming to submit their work to an academic journal here. So I have no financial interest in the mention of anything during the course of this talk here. So we'll start with understanding how the editorial workflow happens here. So that's important to get into your mind so that you know your manuscript will scale through or will float through all this seamlessly here. It's something like if you're planning a travel, you would know you would get your visas, you'd get your tickets, you would plan your luggage. So it's very similar to that. If I have to take a very common time analog here. So when you're planning to submit a new manuscript, you have selected your journal in accordance to the relevance of the topic and the main target audience that particular journal is aiming to cover. So that's important. So learning to choose the right journal for the kind of topic you are looking at. So that's important here. So if you're dealing with clinical ophthalmology, it is better to submit to a clinical ophthalmology journal. But if your article is largely pertaining to community ophthalmology and public health, I think the shift should be towards a public health journal rather than to a clinical journal. So that would be your number one in decision making if you have chosen the right journal, because your chances of acceptance will be better if the theme of your manuscript aligns with the main theme of the journal you are submitting. Then 2 is, please ensure that whatever you have written is explained in your own words and you have not lifted anything, be it a small, be it a line, be it a verse, be it a paragraph, be it a figure, be it a legend, be it a table. Nothing should be from something which is already existing either in a book or in the net or in indexed or non-indexed publications. That simply amounts to plagiarism. So there should be no plagiarism in what you're doing. So the journal first does a plagiarism check here, and then it goes on to a technical check here. In IGO, the plagiarism check, the technical check are all performed by a group of very efficient team of clinical ophthalmologists here who are busy themselves here and have taken time out to look at all the submissions here. And this is done largely by our team of assistant editors, a very young, bright, active team of assistant editors who do the plagiarism check and who also do a technical check on the manuscript. By technical check, we mean that to see if your manuscript conforms to the category under which it is submitted, if it conforms to the requirements of the subheadings or the abstracts, the methodologies, they're all in line here. If the word counts are all in line here, if the references are in order, if the tables are all correctly reported, are correctly mentioned in the text here, if the references are mentioned in the text. So that is a stringent check on the technical aspects of the journal. So only after this is clear does your manuscript then go in for review. So once you submit, it comes to the main editor. the editor in IGO, the editor then allots it for a plagiarism and a technical check to the assistant editors. The assistant editors complete it and pass it on to the main editor, who passes it on, who assigns it, him or herself, or passes it on to the section editors who do the assignment for the particular review articles. Once the article goes to the reviewers then review it and send it back to the editor. Depending upon the comments of the reviewers, the editor makes the decision whether to take it forward or to reject it there. The editor can also reject it at the time of, that's the rejection at the first table. Rejection at the first desk is when the editor itself finds that the manuscript is not up to the mark here. And then if it is reviewed and the comments are good, then it goes further for revisions. And once the revision comes back, there is a re-review on it. So this is a big workflow which happens. And it's important to understand that your manuscript has to go through all these stations before it comes to successful publication. The common errors here, so we'll just look at some common points given the time constraint which we have right now. This is one of the comments which commonly comes after a technical check here, that your word counts are not correct here. So when you're preparing the manuscript, the first and the best thing to do is please go back to the journal instructions and read them up carefully again and check that each part for the category, if you're submitting under a photo essay, if you're submitting on ophthalmic images, if you're submitting a case report, if you're submitting an original article or a review article, that the number of words which you have chosen, if you have of your chosen article, conforms to the requirements here. The best way is before you start writing, you can also think which journal you're going to be writing to. Read up the instructions here and then keep writing in a manner which conforms to, so that makes it much easier here. So the commonest mistake is poor compliance to submission requirements. Please remember this, that when whoever he or she who's looking at the articles already have their folders full of articles. So this becomes a very easy way to reject if you're not comply to the requirements of the journal. So this is something which all of you must not do, and you should not fail the submission requirements, because that will be that really is not, that's something is just simply complying to what is required when you are submitting here. So if this is taken care of, then it just floats through the step one here. The next is plagiarism. So you see that all journals have a very strict plagiarism policy, have a very strict publication policy here, and here it does run it through particular softwares which are paid softwares here. And remember that paid softwares have a thorough check, and most of the free available softwares do not do a complete check as required here. So plagiarism check, so this is an example of a plagiarism check. You could see how how after the check there are multiple aspects which the software is able to pull up and give you a n total percentage of the plagiarism, and it can also give you breakdown and give you what are the various aspects which have been copied from which particular source here. So this really speaks very poorly about the submitting team here. So this is one other common mistake which I see, and I would not call this a mistake. I think mistake is something which is unintentionally done. So copying from other sources is not an unintentional mistake. So I would really ask you all that avoid plagiarism in the work which you're submitting to the journal here. Then we'll move on to the next one is, poor writing style here. So this is one other manuscript. I've taken some live examples out here. This is one of the recent manuscripts, and what you could see here, that in the title itself, there is a word title which is appearing here. So in the title, it should be just capsule, augmented, whatever is this going to be. There should be no other text which needs to be aligned. So you're seeing a short title here, and that again is saying, so this is very poor attention of the author, who has not even bothered to read the submissions before they have hit the submit button here. So this really speaks poorly, and this is also going to give a negative impact on the team which is going to be reviewing. So these kind of typo errors are something which are very, very key to good or encouraging or giving positive views for your particular journal, particular article which is being assessed here. So this is a screenshot of what's available here. Just log on to the Indian Journal of Ophthalmology website. go into the submission wanted, you have all the required information for authors, submission guidelines, and I would advise you all to kindly go through what the category of the submission which you are aiming at and read these instructions before you even start writing. And that goes a long way in avoiding any of these mistakes. We do have recently installed the paper pal, which is a pre-submission check here, and it does have a free submission check as well here, and gives you and helps you on a lot of points, including technical checks, language checks, gives you a report on your checks, and also gives you a downloadable edited file as well. So these pre-submission checks are great methods by which, if you are a newcomer and if you feel that your guidance is not adequate enough by your senior authors, you could put this into this and really help you to guide you through the submission process and see if your manuscript conforms to all the requirements here. Again, this is one other picture, one other article, which I'm just citing. It's a photo essay here. And this particular author claims to talk about angioedema, which is caused after a particular event or a particular drug intake here. But these are the two pictures which are submitted for a photo essay. Nothing is, striking in these pictures to convince the author, convince the reviewing team or the editorial team that this warrants publication. So this is something which authors need to take care that what you are submitting is evidence enough to convince the editorial team about what you are trying to state. That's important, that the content of your submission is really convincing enough to take your manuscript forward. Please remember, this is one of the most important aspects in taking your submissions forward to the next step here. So you will really need to rack your brain and really see that have you written down everything which is going to be evidence-based literature over here, so that it's going to add on to what is present in literature beyond what is already existing new here. And again, if you look at these lines here, there are a lot of typographical errors in this here. So I think in today's era, when digitalization is on the top of everybody's minds here, you see simple typographical errors, that spacings are not adequately done here. And if I have to say 15 and 18 here, refer to reference numbers here, 1, 5, 8 here. And there is no comma in between everywhere. So I don't understand what this is. And again, these references, the way you put references for Indian Journal of Ophthalmology is different, and it is not this way. The superscript, square brackets. So these are simple things which, you people need to understand here. And again, if you're talking about particular units, you'll have to remember that you've given the particular units here. So this all speaks about very poor writing. And this manuscript is definitely going to clearly fail a technical check. So this manuscript will get unsubmitted and go back to the author for correction. So this wastes a lot of important time. And sometimes it takes up to 1 or 2 months before the manuscript gets cleared or goes past these technical checks, and then comes back to the editor to go in for a reviewing process here. So you should remember that the reviewing process starts only once the manuscript clears the technical checks here. There's also a common checklist which is present here, and I do find many of them to tick it up, and this page figures in the bundle PDF along with their submissions here. But several times the ticking is so careless that they have not taken care to see that if there are no typographical errors, that the contact details are given properly, the names are provided properly. So this is a sort of a very comprehensive checklist. And if you really apply your mind with utmost commitment, then I think most of these trivial errors can be avoided when you're submitting here. Another very, very common aspect is the way people mention their references, the referencing styles here. Please remember that this is what you get. The one on the top is what you get when you just copy paste citations which are available on PubMed here. But you really do not need the DOI number, the PMIDs, the other numbers. You don't need the name of the month. You do not need the number of the issues here. So please remember that you only need the year. You will need the issue number, and you will need the page numbers here. And you do not, the volume number, sorry, not the issue number, the volume number and the page numbers. The rest are all redundant stuff, and you do not need to and need to submit this. And it's simply looking at the way your references are placed really tells the reviewers and the editors how knowledgeable you really are when you are submitting a manuscript here. So please remember, referencing is a very important aspect. Again, a few examples. If you go through the instructions, you will know that IGO requires only the first 6 authors to be stated, and the remaining will have to be stated as et al. And again, the way you're putting in the Vancouver style has to is slightly modified, and you'll have to place it the way you need it. This really tells the editors and the editorial team and the reviewers whether you know what you're doing, and you know about the requirements about the journal you are submitting to. So that's an important aspect, and I really urge you not to make this error as well here. Here again, you look at a particular case report, and I think I'm just showing you one of the live screens here. And if you really look at the technical checkpoints which are come back to the editor, or which go to the author after you are after the manuscript is submitted, you can just see the technical checkpoint says that the text is the tables are not mentioned in the text here. You've given table 1, table 2, table 3, table 4, but the tables are not referenced in the or cited in the or quoted in the text itself. The legends are not properly written here. The way references are put on in the manuscript in square brackets, again in superscript. This is one of the most commonest errors which most submitting authors do, and that is not really likable here, especially if you're someone who's submitting. Many times this happens because there are junior authors who are writing the manuscript, and some of the senior authors fail to even guide or even point out these to the to the juniors who are doing. So I would urge most of these submitting authors to please concur with their senior authors and ensure that their manuscripts are seen by all the authors, so that such mistakes are pointed out in time, and these can be corrected before you're submitting, and you do save on valuable amount of time rather than your manuscript going back and forth in terms of technical checks which are there. I think I'm not going to comment much on the academic content because that's a reviewing process itself. But by and large, if you avoid errors by you being careful in terms of good statistics, in terms the way your means and your medians are mentioned, very simple statistical logistics which need to be mentioned in the proper way. And those are very important in avoiding your manuscript into from errors here. So again, look at that you want to publish because your subject is something new. There's some novelty in the work you're presenting beyond what information is already available in the text here. And again, ensure that what you have written is more effective than what is already present here. So your clarity of your scientific message, the format which you have written conforming to the requirements of the journal. The title and the abstract is one of the most catchy things. By catchy, I do not mean something fancy enough or cinematic as in conference presentation titles. But remember, to a scientific journal, your title needs to be scientific, pinpointing what you're particularly the subject or the point which your manuscript is dealing with here. The characteristics of the title need to be paid particular attention to. Your abstract should be clear, concise, and precise to the point here, rather than beating around here. And don't use misleading or misrepresenting narratives in your research writing here. So these are very important aspects here. Your cover letter is a very, very valuable point, and many times I find it's a cover letter which is written to some other journal with some other editor's name, which is then, and it also tends to speak a lot about the authors themselves and where they have published and where they have presented these. But then the cover letter is more effective if you talk about the strengths of your manuscript rather than anything else. Please remember your introduction, your methodology, your results, and your conclusion need to be very strong when you're discussing your paper. References I've already told you here. So I'm going to stop here and share another screen for you to just show you another example of how we can how I'm going to show you a live manuscript out here, and let's again look at it here. So this is one other review which was done for a particular article here. And if you see this particular article which has been reviewed, I'm going to read this out for you so that you understand how things happen here. So this was an article which talks about ocular trauma, and the person who the author who submitted it, or the team which submitted, talked about some 2000 plus trauma patients here. But then the first thing is the grammatical errors which are there, the gross grammatical errors, poor sentence formatting, so much so that the reviewer had to put it as point number 1. So this is something which needs to be thoroughly avoided. And in Indian, I think we no longer can say that our English is poor and can take justification that grammatical errors can be considered. So if you have too many grammatical errors, then it does give the editorial team the right to outright, reject that particular manuscript in terms of poor research writing. Not only the technical aspects of research writing, but the simple aspects of English writing itself. If it's lacking, then it's going to be a huge deterrent in the success of publication of your journal here. There are a lot of other comments, as you see, which are technical points in our academic points here. And all these have been missed in this particular. The topic is about trauma, but the introduction is talking about something else here. And here it says, was the cataract about a penetrating eye injury, a blunt trauma? So these are some things which are to be vividly covered in the introduction itself, though, which means the manuscript is lacking a lot in relevant data to the subject which is being discussed. And you could see that the abstract is not in order here. You can see the introduction is badly lacking in terms of everything. And here you could see the reviewer has done a thorough job in looking at every paragraph, every line, every page, and then point out that, there are way too many errors in this particular manuscript. So this is just one of the live, this is a live review from one of the reviewers, which I'm just sharing here to give you an idea that there are far too many errors in this particular manuscript which is submitted. And again, something very common is that they have cited Dr. Murthy's work here, but that reference is not shown in the manuscript at all here. And some of the references are there in the reference section, but they don't figure in the section which is they're not even cited or quoted in the manuscript as well. So I'll just show you one more before we finish this. Before I finish, I'm just showing you this other. Oh, I'm sorry, I shared the same one again. So let's look at the reviewer comments. So just take care that you are particularly looking at every manuscript when you are submitting that particular manuscript to the authors here. I think we'll stop here, otherwise it becomes too specific in terms of technical terms here, and we might probably take more questions and doubts from the team, which is the expert panel which is assembled here.
Thank you so much, madam, for highlighting on the nitty-gritties of manuscripts writing and submission. That was really wonderful. And with this, I request our chairpersons to have their inputs. Dr. Purvi Bhagat.
Yeah. Thank you, Professor Vanati. That was an excellent compiled presentation of covering all the points that would be required for journal submission. And I'm sure the audience is definitely going to benefit from all of this. I would just like to emphasize on and add a couple of more points that, of course, when you submit an article, the acceptance finally relates to the science and the research and the study that is done. But if we talk about the technical aspect and the scientific writing part of it, if the authors just go through the author guidelines and instructions very carefully, then that itself is like the whole task done. So the first and only thing rather that needs to be done is follow the author instructions and guidelines. Because that not only saves a lot of trouble to the editor and the technical team out there, but it also it saves a lot of unnecessary to and fro going between the publisher and the author, asking for technical checks and changing word counts and all those things. So, however good your research may be, if you have not written it properly, then you might just end up in an unnecessary desk reject. And the second thing that needs to be also confirmed is the authorship when you submit an article, because a lot of times those requests after the submission, they keep coming up that now we require this change in authorship, or we need to add authors or remove some authors, and all those ethical issues come up. So that is also very, very important, that before an article is submitted, please confirm the authorship, the names as well as the sequence of the authors, to avoid any ethical concerns later on. And of course, sometimes we have also seen that the articles once submitted, especially this has been very common with residents, because they are required to have publications for their university examinations and all that. So sometimes they just submit and they forget about it. Or once you send them the acceptance letter, and then the students, they forget about it. Then all that galley proof and proofreading and all that, they simply don't revert. So that article is stuck in the portal just like that, without anything being done. So once you have submitted an article, please keep a track of where it is going, what stage it is in, and if you're receiving any mails from the publisher and all that. So couple of more points that need to be kept in mind. Thank you.
Yeah, thank you, Dr. Purvi. Dr. Apurva.
Thank you, sir, for letting me be in this very illustrious webinar. I have only a couple of points. First is that especially when there are new senior residents or new fellows, they tend to submit articles just like they would have submitted a protocol or a thesis. So that's a major pitfall, I think, because they say they don't know how to write a paper. Well, did you know how to do a vitrectomy? So if you're doing such good vitrectomy right now as a fellow, when you know how to do one, you can definitely learn how to write a paper as well. Now, one thing I always feel is that we write as much as we read. So the main thing for writing is the more you read, the better we write. Like this is true for general literature also and academic literature also. So a lot of prolific researchers spend a lot of time doing a lot of review of literature. And one way to ensure that you're reading a lot is by subscribing to table of contents of many major journals. And the second most important is by providing your services as a reviewer. You become a reviewer for journals and you sign up to be a reviewer, you tend to read a lot of submissions. Some of them may be very high quality submissions, which will inspire you to write like that and maybe build on an idea that you get from that high quality submission. The other side is a lot of low quality submissions and seeing them getting published eventually and making you feel that, you know what, if this can get published, so can I. So that is one thing. And in fact, one of my first publications was a commentary on a paper. I had so much to say about the paper that I was invited to write a commentary about it. Because and then it starts like that, writing commentaries, case reports, photo essays, and eventually you will become mature enough to write an original paper. And one thing which I think I learned from Vanati ma'am only in one of the previous webinars, where she said the cover letter is also so important. We tend to write very generic cover letters to dear editor-in-chief, please accept our paper for considering it as a manuscript in your esteemed journal. This is what we used to write. But then she said, personalize it a little, maybe to the chief editor-in-chief, Dr. M. Vanati. Please see this manuscript. In our manuscript, we have written maybe 1-2 lines about how important your paper is. And then that gives a very positive tone to your entire submission. And the editor already is a little impressed by the way you've written the cover letter. So I think that's my 2 cents about this whole thing.
Dr. Vanati, you talked about plagiarism check. How much percentage of plagiarism is acceptable?
I would say 0%. Okay. The publication policy, according to the ethics of publication policy, plagiarism is not acceptable at all here. So if you look at, sometimes there are, even group of texts, for example, if you're talking about anti-VEGF injections, there will be preludes and postludes of a particular, so which are also taken as a plagiarism when there is being checked. So when you look at the entire content of a plagiarism check here, it does break up and it does tell you from where the plagiarism points are arising. So this is thoroughly analyzed by our technical team before they say this needs to be refused here. So if you're looking at a review article, anything, over 15% is not acceptable, 15% and above. So 12 is something is sort of okay. If you sort of see a lot of plagiarism on that, then I would not accept a review article if it's coming. If you're looking at original articles, then a lot of your discussion needs to be original. But very sadly, you do find a lot of the introduction, a lot of the discussion gets lifted from similar papers here. And now everything gets picked up here. And when people are, you should remember that those who have already published on a particular subject which you are also writing will tend to come and read that literature when something new is being written. And those people will be will be experts in picking up that parts of their texts have been plagiarized in your article here. And nowadays it's very easy to contact the editor of the journal where a plagiarized publication has come through. And this just comes up as soon as the TOC is showing up online here. And it's very sad. I think last year we've had 2 retractions here, and 2 retractions from very, very upbeat authors and institutes here, which is not something which is acceptable, and which is not something which you could say I did it not knowing. I'd say a mistake is something which is unintentional, but these are mistakes which are being intentionally committed here, so they do not, fall under the category of a mistake. And I think as Indian ophthalmologists, I think our intellect and our capabilities and our commitment is much higher, and our moral compass needs to be much more stringent, that we do not resort to such measures. Can I invite, I think we have 2 of our assistant editors who are present here. I think we have Sahil here and we have Surbi here, and they are the people whose eyes fall critically upon every submission. And I would welcome both Surbi and Sahil to put in your viewpoints to the audience to help them to refine the way they approach manuscript writing and submission.
Thank you very much, ma'am. Thank you. I don't think there is much we can add after you've already covered most of the points, and I did see a lot of our comments were actually put up by you to share with our viewers today. What actually makes me sometimes I just see so many articles which I feel that there are so many technical and grammatical errors that we probably should not be proceeding for a tech check. Even we should outrightly reject the article and then invite the author to actually resubmit this article once all the editing has been done. But with Vanathi ma'am, she has been trying to create a very supportive environment for the authors. So we usually, even articles that are very grossly badly written, we usually don't reject them outright. We even offer them maybe mentorship to, if the data quality is good and we feel that only the writing is the problem, we are even offering mentorship to such articles now, wherein an editor or an assistant editor from IGO will actually work with them to enhance the quality of their article. So actually, this is a very good time for budding writers to submit to IGO. You can actually, we're not rejecting any articles outright, giving a lot of support to budding authors to actually help their articles. Sometimes if it's not suited as a original article, we will modify to as a brief report or a letter to editor just to encourage them to publish. But what actually makes me, what is actually not acceptable and what is the saddest part of the submissions that we receive right now is we will submit, sometimes we'll get an article that has so many errors. We'll diligently go through the article, submit a list of 15 or 20 suggestions even sometimes to make the article better, to take the technical points better, sometimes to make the language better. Sometimes the recommendations are very specific, modify this thing in line 25. And we keep on getting the same submission back again and again, without the authors making us, sometimes they don't even make a single change. They just submit the same article back again, hoping that maybe this time we will let it go through. And that is just sad. That is disrespectful of the editor's time. And I fail to understand why anybody would do that. Sometimes they'll take care of 2 or 3 points and ignore the others, which will actually take more time to do. If I have written a specific point and along with that I have written a general recommendation to improve the grammar of the manuscript, they'll take care of the specific point, won't take care of the point that would actually take up more time. Please don't do that. That is not acceptable and it is disrespectful.
Dr. Sahil, are you there? I did see him logged in. I guess when he comes back, we could take more of his
Yeah, he was-
discussion. Yeah. Sahil, are you there? Okay.
No, I can't see
I
him.
can't see him now. Yes, probably he's logged out. I think if there's anything else, I also would urge most of those who are submitting their revisions. There is a very nice table here. So you just have to put down which page number, which line number the revisions have been done, and also include the revision text in the table as well and highlight the text in your manuscript here. But I also find some oversmart authors here. So they do highlight only parts of the revisions and they would go in and correct even statistics and numbers in the rest of the manuscript and not highlight it. And sometimes when we thoroughly recheck, we do pull up these errors here, and this is not a very desirable attitude of authors. And this has happened with some top level authors and top level manuscripts here, and we had to reject those manuscripts because you are manipulating with your data, not highlighting it, thinking that the editor is not going to look at it and will not know that you have changed data at a stage when it's coming in for revision here. These are also, attitudes and behaviors which are not becoming of people of high caliber, and that's something which I would also urge people to refrain from. But in short, please do revise, please do highlight all the revisions, modifications, additions, corrections which you have done so that the editorial team will be able to see it very explicitly and will be able to assess it and whether they agree with the revisions or whether they want further revisions or they want to reject the revisions. That also helps a lot in taking your manuscript through, and that also gives a very positive attitude towards your revisions. And again, in revisions, it is not necessary that you will have to agree with every viewpoint the reviewer is giving in. If you're able to justify your point of view against the point which your reviewer is raising in a way that it's convincing, it's acceptable and justifiable, many reviewers do accept it, and several times the editor-in-chief can overrule the reviewer's opinion on that particular point if you're able to put it across nicely in an acceptable and a justifiable manner. So that's very important. At the end of the day, it is not personal bias, but it is simple science which we are looking at. And we just want good science representing Indian ophthalmology in an international arena. That's all which we are all, working towards. And I really thank the entire team of people who are reviewing, who are doing the technical checks, who are putting in their inputs here, the audiences, and the various others who are contributing in terms of commitment of time, in terms of commitment of their knowledge, and in terms of enhancing the budding ophthalmologist work to reach higher levels.
Good evening, madam. I have 3 questions for you. I need your guidance. What is the role of self-citation? Is it acceptable or not? Secondly, what is exactly salami article? And thirdly, how to identify predatory journals? So I need guidance because my students often do these mistakes while submitting the manuscript.
Okay. I think Sabyasachi is here. Hi, Sabyasachi. Would you like to take that? He's an expert in guiding us in this. And
Yeah,
I've
yeah.
loved many of his talks in which he's referred to all these three.
Yes. Okay.
So, so the predatory journals mainly are, first and foremost, if you're looking to submit, always think about submitting to a PubMed indexed journal, because that's because PubMed has a lot of checks and balances which don't allow any of these predatory journals to be part of PubMed. So
Okay.
then first and foremost is, if you are submitting to a PubMed index journal, then that's about it. Then you don't have to worry about it. So first and foremost, I think just check if it's a PubMed index journal. If it is, then it's pretty all right. Now, but yet now, most of the PubMed index journals are a little bit elite and it's not easy to get into them. So now when you're looking at non-indexed journals, not PubMed index journals, then that is where, all of this diligence has to come in. So we need to see, whether they are publishing it on a monthly basis or a quarterly basis, and whether the issues are coming out on a regular basis or not, who's the editor of the journal, whether it's being run by a state society or something, or it's, a third party whom we don't really know anything about. And all of those things. So there are a few things that we need to look at. But first and foremost, if it's an indexed journal, PubMed index journal, that's about it. Like IGO case reports is not yet indexed, but when you go to the website, you will see who is the editor, and everything else on the website is perfectly fine. And I'm sure it's in the pipeline. So so those kind of journals are pretty fine. So if you see, it'll show that it's a state, it's from the AIOS. So then that's pretty all right. So that was about predatory journals. I'm not able to exactly recollect some of the other
Salami
questions.
slicing. Salami
Yeah, so
slicing.
salami slicing is really, splitting your data into making multiple papers when it would be better to put all of them together in one paper. So here we are looking at what is the primary outcome that you were trying to study in the beginning. So if your paper is talking about the primary outcome and all the other things are also influencing that primary outcome, then don't make all these other things as primary outcomes and write papers on each one of them. Say, for example, if you're looking at endothelial counts and say phaco versus small incision cataract surgery, and endothelial count is the primary outcome, right? You have studied many other things. So however, you could look at intraocular pressure as a primary outcome and write a paper on phaco versus SICS and how it influences IOP. But then does IOP also influence the endothelial count is something that we need to, you need to be diligent there. So you could write a potential paper where IOP is the primary outcome and you're actually talking about phaco, SICS, and then everything about IOP, intraocular pressure, as one paper, but your primary paper actually was about endothelial count, which is a separate paper on itself. So, this is an example where you could think about salami slicing, but then, I would still not advise, because, you didn't do much to, to focus your study on intraocular pressure. So, consider salami slicing only if there is so much that you have, captured, that you're not able to put everything into one paper, and that everything else could now come together. All the other things, extra things that you were having could not be put into this paper, and it makes sense to then, add something more to literature, and that there is something substantially adding more to literature, and also that your study of the secondary outcome is adequately powered to answer that other question that you were asking. So if that is the case, that really comes out with a lot of large randomized trials and all of the other things where you are actually, capturing so much data that you're not able to put them all in one place. So, but then, 90 out of 100 times, salami slicing is done with too few data points, and then perhaps is not okay. So, if a blanket statement is don't do salami slicing, do it only if it's only if you can justify it, like ma'am was saying before.
I think salami slicing can be considered if you're looking at a PhD thesis. Again, in a PhD thesis, I think what you rightly stated is, if you're going to break it into two publications, then you will have to see, was the data you're having adequately powered enough to look at two separate research questions which are aligned in line with each other. Right. It's usually not possible in a PhD thesis, and it shows very nicely if somebody is going to do that, and it will end up with bad rejection comments if you're doing such case. And the first point you asked was about self-citations. If, for example, you say, I'm writing an article of, say, ocular graft versus host disease here, and I have some of the best publications of ocular GVHD in Indian data here, because it's not a disease which is very commonplace. It's a niche, it's a niche segment of a corneal practitioner as well here. So I would have, say, 4 or 5 original articles, and I have data. So which means I would be citing my work in a review article. So that comes on as a self-citation here. But then if I am probably writing for IJO and I am citing these manuscripts which have been published in IJO, these self-citations will also affect the journal citations here. So when you are looking at the citation index of a particular journal, there are two factors, there are two values given. One is which includes the self-citations of the authors, and two which excludes the self-citations of the authors. And by and large, see, writing commentaries and all this increase your self-citation, which pushes down the value of a journal. So that's something which we need to understand here. It appeases a lot of people saying, okay, I've got one PubMed indexed publication by writing a commentary. I would not agree that a commentary can be written by someone who is probably budding in a particular specialty, but a commentary needs to be written by a person who's an authority in a particular specialty. But sometimes it's a dual-edged sword that people try to appease reviewers. They say, okay, you do a lot of reviews, I would give you 2 commentaries. And that's an attitude which I really do not align myself with here. And I do think I would probably go down the favoritism of many people because of this. But if I'm looking at pushing IGO further up in terms of moving from being a Q2 journal to a Q1 journal, I need to cut down on the presence of unwarranted guest editorials, commentaries, letter to editors, and brief reports, because these are not going to help a journal be viewed in high standards here. So there is a fine balance between both here, and we need to understand this. So if a journal is having a lot of self-citations, the journal's value is going to go down. And if an author is particularly going to quote his or her own articles more, again, your H index and your other validating indices for your research quotients also go down. That's something you need to understand.
Dr. Vanati,
Yes,
I have a question.
yes, ma'am.
Whether it is allowed to take help of AI for language writing, is it advisable, not advisable?
Okay. Sometimes, I get some of these Chinese submissions, or I should say many a times I get these Chinese submissions with flawless English, and it is AI written. And again, remember, the AI is not going to look at it with the plagiarism aspect. When you have something using AI, your plagiarism quotients are probably going to be much higher. So, you will have to use it wisely. So I would say that we are not writing a literature article here. So you do not need your English to be really flamboyantly on top of the line. You just need to state your research finding in very simple English, which is just grammatically right. It doesn't need to be, you don't need to use a fancy pronoun and your fancy adjective or anything. It's just stating the fact as simple and as truthfully as it needs to be. And you really don't need to worry on being an English master for that. So I really don't see the need that you have to use an AI to write simple sentences of the research, describing a research which you have truthfully done.
Yeah, many times nowadays students are writing their theses using AI tools.
I think that's it's really sad to see how they are probably not taking the help of AI in the right way, or they are rather abusing a digital advantage which they are having and using it in the wrong way. It really does not help your mind. The more you think, the more you write, the more you read. I would really agree with what Apurva said, right? The more you read, the more you know what is the right way to write. It's as simple as that. So if you just take out, say, 2 hours when you are in terms of your training, just take out a particular evening to have 2 hours, which is something like a journal club where you would open up a few journals, related articles, just put in a particular topic on PubMed, pull out those articles and just read. That itself enhances your knowledge and your approach to writing in a very good manner. I think Dr. Charuta has a question.
I'm Dr. Charuta. Thank you so much for having me here. And Dr. Vanati, this was really wonderful. I had a thought and a suggestion that what happens is that when the students are going in for their thesis or for final thesis approval or for their publication, then we start looking at the English. The English can be looked at when they come into us, because all the messages, WhatsApp messages that they send, because now the new generation only writes very poor English. I feel, unfortunately, on a regular basis, even the letters that they write. And many times the universities are accepting answers given in improper English or local languages. So what happens is that they don't feel the need to improve their English unless we as teachers do that. And then our integrity itself, our student integrity, and as Dr. Surbhi said, that we are not at all respecting the time of the journal. So one suggestion would be that we could all, and our residents could all pay attention to the English right from the beginning. If they haven't before, then at least when they come to a professional college, that they pay attention to English all the time, and we correct them even if they may not like it. And we have also what you said just now, the journal clubs. We had a good meeting with Dr. Sabyasachi, and so all students who have been trained by him, now we are having a lot of journal clubs, and just reading that makes them better. So I just want
another suggestion is for most of us who are faculties in medical colleges, be it government or private. I think 80% of your manuscript writing, if you're looking at thesis, is done when you're doing your protocol itself here. So if the introduction is well covered, the review of literature is done comprehensively and in the right manner, and if your methodology is written well, then what you probably need to add on is the results and the discussion here. So almost say 50-60% part of your thesis is well written if your protocol is well addressed here. So you have time enough to correct the candidates or the thesis candidates or the students writing here. And I think the students will also have to strive to write a good English here. That's also, it's a commitment from both ends here. It's something like, you cannot expect a good manuscript or a good paper if your thesis idea itself is not good enough, if it's not novel enough. And you cannot place the justification that this is a thesis, so I cannot give anything beyond this, I think there are ways and means a human brain can look at a particular aspect to make it useful both for the researcher and for the student here. That's our duty as faculty, to stand up to the commitment to teach our students the right way to do research, and however small or however big it needs to be, and not blame the positions we are placed in or the situations we are placed in for poor research work, and then claim that the journal is not accepting our papers. Why would not an editor, he or she, want the best works to be present in his or her journal? That's my only aim. I want the best of the research works to be showcased in Indian Journal of Ophthalmology. And if you are giving it to me, why would I reject it? That's the bottom line of the work which all of us as a team are doing here. Yes, Surbhi.
Just a small suggestion, since we were talking about English language, something that I used personally a lot as a resident, and sometimes which I still use for some of my letters, is there is a plugin in Word called Grammarly. Now, some of its features are paid, but a lot of its features are actually free. And it's a very good basic check for anybody who is not sure of the language of their paper, to put it just there, and it'll give you really nice suggestions about how to improve the language of your paper. And that's one. And the second is, when just for residents and younger authors who are submitting, if you want to improve, you want to think how this paper will appear to a reviewer or an editor who's looking at it, try to think in a point of view that I don't want to give them any reasons to reject. Make it difficult for them to reject. So if you're giving them reasons like grammatical error, you didn't put the references right, you didn't enter all the authors' names, you're giving them easy reasons to reject. So just think about it in a way that I want to make it difficult for them to reject my manuscript, and submit with that attitude.
And I think a nice way is that, several times when you are preparing a manuscript, it does take at least 6 to 8 weeks to write out, even after you complete it. 6 to 8 weeks is still less. Sometimes it might take up to 3 months for you to prepare a good research writing paper here. And you've been at it for so long that your brain is very fatigued. So you can take a break from it, or you can have a fresh pair of eyes, look at it, and you would probably, and that would really, a couple of your co-authors to look at it afresh, and that really helps to correct a lot of those errors which you probably, were not able to see, or you did not think that this needed to be improved upon. That's another way by which you could always work and improve the quality of your manuscripts.
Ma'am, can I just
Yes, sir. Yes. Yes.
So, using AI to write papers is inevitable. It's something that we all have to agree to disagree or not. But, let's face it, as from an editor's point of view, this is just going to happen. It's a wave which we
It's
can't
going to
stop.
happen. It's going to happen. And I think we don't
process-
have so much of resources to even detect it. It's only that if it's picked up on a plagiarism, then it's going to be detected.
So basically for authors, I think what is important to understand is the prompt that the AI works on. So garbage in and garbage out. So if you're, giving it very poor information about your methodology or your results, or results can't be written, right? By the AI. You have to write it yourself. So if your basic writing is good, it can be enhanced with the AI. And then, the thoughts are still yours, but the language is now better. It's easier, more understandable for people. And I think that is pretty all right. And it is still within the realms of ethics that we are talking about here. So your prompts have to be good enough for the AI to enhance it. Because if your prompts are poor, the AI output is going to be gibberish. And you yourself will think, oh, this is something that I didn't want to communicate. There's something that is totally different from what a lot of authors don't even think about it. They just put in some gibberish. AI gives them something nice and they just copy paste it. And when you read the whole paragraph, you will see that none of the lines are interconnected with each other at all. Though they are in perfectly good English. But they are all talking about, there is no theme to that whole paragraph. And the biggest giveaway is that the results are very poorly written. The introduction is very well written. However, the lacuna or the gap in literature is missing. That's because the author didn't put in that much work. The methods is perhaps immaculately written, but the statistical analysis part is pretty poor or even missing. The results are appalling. That's because it is written by the author themselves. And the discussion again perhaps is all right, but then the things that they should have focused on to discuss have not been discussed at all based on their own results. These are few things which will help us weed out that this is perhaps so sending an article out for review without it having a gap in literature where it looks very nice and polished, but that gap in literature is missing, is not going to be attractive for the reviewer either or the author. So overall, I think for the authors, the prompt that you give the AI is most crucial. Unless you work on your English grammar, the prompts are going to be poor, and therefore your paper will still remain poorer and in fact get poorer. That's because these all going to be disconnected. And the message is not going to go out, and you will definitely face more rejection. So AI is not the answer outright. The answer still is within us. So we need to train ourselves, and use the help of AI as a co-pilot, not autopilot. That's what I have to say.
Any inputs from other discussants?
Hello.
Yeah.
Yes.
Vaishali.
Yes.
Yeah, hi.
Excellently, all the take-home messages are so beautifully told by each and every speaker. Like each one had to add such wonderful tips. I just want to the one which struck me was that we are sending a article to something like Vaniti ma'am said that clinical ophthalmology, if it is an article related to community ophthalmology, and if we send it to, so naturally that was really like our residents also need to know that what is their thesis topic or where do they need to send. So can we have something like guiding signs, which articles or something of that sort? Like all manuscripts do not need to be sent to IJO or like that.
Yeah. I think you have an online journal finder and you can go in and put in your subject of research, and that will give you a few suggestions of the most relevant journals here. But several times I mean, it's very clear to the editorial team here. For example, you are having a large scale community ophthalmology study coming to your journal. It's very clear that a public health journal refused it, rejected it, and then you're trying it out. The same thing happens with cataracts. Then you have a very nice cataract or a refractive article which is sitting here with a lot of stats. Then I know that IGO was a second-rate choice here because it was rejected. And that pulls up the editorial team to look for the flaws in that particular manuscript, why this was rejected here. So that's why knowing your primary journal, which would probably accept your work here, is important. Again, it's again not important to think, okay, I need to publish this in Journal of Refractive Surgery. See, I know my article and I know the pitfalls or the weaknesses of my particular article. And it is always wise that the author discusses the pitfalls in the discussion here and how this probably could be addressed when this article is being read or being interpreted here. So how much of the data which you're presenting and how it should be taken or interpreted for the application to their clinical practices here. So if you know that your level is not up to the level of being published in ophthalmology, don't send it to ophthalmology, take the comments from there and then come and submit it where IGO. The editorial team can see that very blatantly here. So it's really important. And I do find many people tend to treat Indian Journal of Ophthalmology as a community ophthalmology journal. I think that's an attitude which we need to stop to do. And we have to think we need clinical ophthalmology articles of good standard logistics, good standard methodologies, good standard statistics. And until and unless we as researchers make IJO our first choice, not because our article is not going to get accepted anywhere else, but because we want to push our journal and we want to see the best being published, best of Indian work being published in our journal. Until then, I think we will not reach Q1. We will still remember Q2.
Thank you, ma'am.
Yeah, thank you, Professor Vanati, for sparing your valuable time and guiding on manuscript writing and submission. I hope this session has provided you with valuable insights into the common pitfalls in manuscript submission and practical ways to address them. By avoiding common errors and adhering to best practices, we can enhance the quality and impact of our research publication. I thank every one of you from the bottom of my heart for joining and giving valuable inputs. I thank Entor for providing platform for this session. I invite Entor people for their video.
Rajesh, can I just make a quick comment?
Yeah, sure.
So, IGO is open access, as you all know, right? You don't have to pay to read it. You don't have to pay to publish in it. And there are very few, so this is absolutely like an open access. It's like, there are no article processing fees and it's free to read. So you will hardly find any journal like that, which is such high quality and yet totally open access and free to publish. So, if that is not enough in attracting the best papers from India, where, we are, we want our readership to read it because it's about our disease, right? So our own papers and our own data must look at IGO as the first journal of choice, not simply because it's open access, but because we want our people to benefit from the work that we're doing. And of course, the added benefit is it's open access and it's free to, the readership that you will get if you publish in IGO is far more than even if you publish in ophthalmology. Because most people will read your abstract and not the whole article because it's behind a paywall, right? So I think therefore it really makes sense to think about IGO as your first journal of choice with the great editorship happening and articles being processed pretty quickly. I think IGO should be the first journal of choice for most of us.
My just kind request to Professor Vanati to excuse for photo processing charges. If you can take it further.
I think whenever you're running an establishment, you also look at ways by which you can self-sustain the expenditures which are there for a particular thing. And when you have to look at, say, a company to sponsor your charges, then you also will have to submit to the many obligations and restrictions and the requests that particular firm or company is placing upon you. And the quality of your review and your work goes down then. So I think we also need to, so if you're driving your car, you must be earning enough to fill the gas for it. Otherwise, you don't drive a car. So I think if you really compare the photo processing charges for Indian Journal of Ophthalmology, it's peanuts compared to what other international journals are providing. And again, if you see most of the other journals like ophthalmology, their annual subscription is huge. Here, there is no annual subscription for any reader. It's absolutely free. And what you are publishing will be read by any ophthalmologist across the world, which means it increases the citation value which you get for your work which you're getting. It's your visibility, your citation index absolutely goes high if the quality of your work is really good here. And what you're paying is absolutely peanuts in comparison to the amount of article processing fees which many other journals have here. If you have to publish in cornea, if you have to publish in ophthalmology, if you have to publish in several other journals, the fees are much, much higher. And many of these are now not so, even though they are aligned with societies, they have huge annual subscription fees as well here. So here we are catering to the readership of 26,000 plus ophthalmologists across the country. And what you have to probably give is peanuts here. And you will have to remember that the cost of running or publishing the journal per month is about 15 lakhs for a single issue of PDF which comes online. And who's going to give? AIOs will not pay you 15 lakhs. You will have to generate your own money here. And there is no article processing fees. And I think whatever rates we are following is the same rates which Dr. Santosh Honawar has been following. So right for the last 7 years, we have not had any revisions despite the high increase in inflation. And we have only increased at 10% last year. That is also because we will have to at least sustain without, looking at other people who can compromise the way we are working. And I think if you go for a simple movie theater, you would land up spending for a family of 3, at least 5,000 rupees. If you can spend that much for your entertainment, why can you not afford to spend something which is the thing of your life? You are all working for better academics and better ophthalmology. I see no excuse for that.
Ashwin? I think he's not there. Okay. Fine. Thank you. Thank you so much, madam, for you guiding us on manuscript submission. I thank everyone for joining and hope to have a similar type of webinar in next 1 or 2 months. Thank you.
Wonderful. Thank you so much.
Thank you.
Thank you, Anandha, ma'am. Thank you.
Thank you, ma'am.